Good morning. It is Thursday, August 5th. Welcome to the Morning Medical Update. Today we are talking kids and school. It is a hot topic right now as parents try to prepare their kids and, let's face it, themselves for back to school unknowns. We are going to take a different look at how COVID may impact your child. We're going to hear from two of our doctors on how mental health concerns continue for kids and parents. Dr. Danielle Johnson and Dr. Mitchell Douglas are going to join us. So we are glad you both are here. Lots of questions have been coming in over the last couple of weeks as we, get ready for all this. So hang tight. We're going to get with you in just a moment. But first, let's get to Dr. Dana Hawkinson joining us with the COVID count. Good morning.
Yeah.
How are you?
Hi. I'm doing pretty good. How
are the numbers looking?
Numbers are kind of holding steady. We were, I think, up to 40. We have 35 active infections right now, 12 in the ICU, 9 of those on the ventilator. We still have 13 additional patients in that recovery period, so our total number is down to 48, which is a little bit improvement. But again, I think over the next 4 to 6 weeks, we're really going to be able to have a better judge of how this is going. Again, believing it's more about the hospitalizations rather than the true testing for the bellwether of how the surge or the pandemic is currently going in our community. And then Hayes has 6 active and 1 in recovery as well.
All right, still not great. No. Thanks for the update. We're going to get to some reporter questions. Do we have a few on the line?
Yeah, sure. Good morning. Cody Holyoke with Channel 9.
Hi.
Hey, guys.
Cody.
Hi. A couple questions for Doc Hawk here. It just came out yesterday that organizers at Arrowhead were going to require masks for the big Garth Brooks concert, 70,000 people in one place. I'm curious, and there are other big events too. I think there's a Foo Fighters concert tonight to a different spot. What do you recommend if you're at a place like that where you're in close contact but you're outside? Because it kind of goes against some of the recommendations that the people are hearing, at least with indoor activity.
Yeah. We've always said that outdoor activity is better. You have less risk of spreading the disease to other people, but also coming into contact with those droplets should there be somebody who has it who is spreading those droplets into the environment. So the outdoor situations are a lot better. Look, we know what to do now as a community, as a medical institution. We know what to do individually to keep ourselves safe. And the first thing is get vaccinated. And then it's always going back and falling back to those non-pharmaceutical intervention, those NPIs, such as masking and distancing as much as possible, doing things outdoors. We know that the economy is getting back. We, as a nation, certainly compared to other countries, are doing much better as far as trying to get things back to normal, whether that's directly in the face of the current surge or pandemic or whether it's doing it in a thoughtful manner. All of these things that are continuing to go on are certainly, those decisions are made in a thoughtful manner, but now it is down to every individual who might be doing some of those gathering and understanding what is your risk, what is your tolerance of your risk, and so doing those individual things such as vaccination and masking and distancing as much as possible at this point in time will come down to that individual. And those are the best things that we can do, is continue to promote those types of interventions. But again, I believe still the first thing to do is continue to get vaccinated, continue to talk with friends and family who maybe are still vaccine hesitant, get them vaccinated as well. That is what is going to be able to keep us doing things like concerts and gatherings. Like I said, especially now that it's still warm, we still have that ability to do things outdoors, which will help greatly as well.
Nice. One quick question, and as you deal with the majority of unvaccinated people in the hospital for COVID, I'm curious because, you're dealing with patients directly. What are the biggest reasons you're hearing from unvaccinated COVID patients on why they haven't gotten the shot?
The reasons still are, age, because we are seeing a lot of young people. So age is a big one. I didn't believe it would cause me too much illness or make me this ill. That is a very common one. We still do hear comments about experiment. And those are really the biggest ones. The vaccine is so new, it's still an experiment, but also a lot dealing with age and just thinking that they aren't as high risk of getting ill enough to go to the hospital. And then, of course, having all the symptoms that may lead them into the ICU as well.
Thank you.
Other questions on the line? Okay, we want the community, of course, to start sending in their questions. And what we don't get to today, we're going to do tomorrow on Follow-Up Friday. So we will get to those. But I do want to turn to our guest today, Medical Director of the Miralac campus, Dr. Mitchell Douglas, and Psychologist, Dr. Danielle Johnson. Good morning to both of you. How are you?
Doing great.
We're glad you're here. We need you. We need you. Okay, we know mental health just as important as our physical health. The countdown is officially on. I just really want to ask you both kind of what is keeping you up at night? I mean, 1 week from today, many kids are going to be back in the classroom. Dr. Johnson, let's start with you. What's concerning you most?
Really as if our kids are going to be masked back in the school. And so we are wondering for different school districts, are they going to wear a mask or they're not going to wear a mask, and kind of the safety around that. Some of the kids I've worked with, they are concerned with, well, if I wear a mask, but my friends don't, like, how does that impact me, and what if I'm made fun of? And so there are a lot of children that are concerned with if they do wear a mask or if they don't wear a mask, kind of how they'll be perceived by their peers, and really how that's going to work for them.
I saw this list this morning on the news, like, unmasked, of all the school districts, unmasked, unmasked, and I saw my kid's school district on there. It was very concerning. What are your thoughts?
What's keeping me up at night right now is it is August, and the beginning of the school year has always been known as a time where the census and the need for inpatient psychiatric services just skyrockets. I mean, you can just almost look at it like to a T, where school started up, and then the following week, we are at max capacity.
So for folks who don't know, tell them about Miralac, what they do, and then what you are used to seeing when it comes to school.
So I'm Mitchell Douglas, Dr. Douglas, Medical Director at Miralac, which is inpatient child psych hospital, seeing kids 4 to 17. And pre-COVID times, we would know summertime, the census would drop. We would be in the about 25 to 50% of our school year census, and then within 1 to 2 weeks of the initiation of the school year, our census skyrockets. And that's in some ways it's a bad thing, it's a good thing. The experience is that the kids are going to school, and some of the risk factors are being identified by the teachers, by the social workers, by their overall community. Part of it too is that they're in a stress-free environment. There's no summer during the summertime, and we are going back to school, and we're dealing with waking times and school stress and social stress that's causing such an increased anxiety or stressors that it's leading to really pretty dangerous stuff.
Well, let's compare this time last year to now, because we were looking at kids not being in the classroom. That was a huge concern of yours last year. But the concern doesn't stop, because now they're going back to school and have this kind of all over again.
And they're going back to school, plus the additional stress that Dr. Johnson's talking about, where we're doing this with the additional stress of an ongoing pandemic.
Right.
So,
I want to talk to you about a study that was going on, or that Children's Mercy was doing. I'm going to put this up on the screen. But a new study looked at implementing a hospital-wide program to identify teens at elevated risk. Patients 12 years and older were screened for suicide risk, again, over at Children's Mercy. Now, during the first year, nearly 140,000 screens were completed. 6.8% of screens were seen to be positive for elevated suicide risk. So I just want to hear your thoughts on the numbers, and then just your thoughts on those screenings in some of those additional places like hospitals and schools.
So those numbers actually sound almost a little bit low.
Okay.
We know from data sets for doing screenings like this, over the last 10 or 20 years, you can see 17% of kids reporting having suicidal thoughts in the adolescent population. So we're talking 12 and above. Around 70%, some screens will show suicidal thoughts in the past year, with looking at a 5 to 6% number with serious thoughts with intent. So those numbers do not surprise me at all. And I think it's a really big indication that we should be doing screening. We should be doing screening in hospital systems. We should be doing screenings in schools. We should be doing screening where there are kids.
Makes sense.
I mean, just wherever the kids are, we should do it, because this is one of the leading causes of death in kids and adolescents. If we're trying to keep them safe, we got to ask the questions.
What are you hearing from your patients?
Kind of very similar. I'll note that the CDC recently released a study that showed that 50%, there's a 50% increase from, I believe, in Dr. Douglas, help me if I forget this part, I think from May to August of last year, there's a 50% increase in the number of suicidal kids put into ER departments. And so we're particularly among female adolescents. And so they highlighted 12 and up for females. There was a 50% increase over the last year with kids presenting with either suicidal ideation or suicide attempts. And so we're seeing a population of folks, particularly young females, who are presenting with increased stress that's resulting in suicide attempts that we have to monitor, as Dr. Douglas said. meeting kids where they're at. So pediatrician office, schools, churches, where kids are at, we should be able to have the questions of how are you feeling, how are you doing, are you thinking of suicide?
And I should be clear, the screening isn't just to ask the question. The screening is to identify, refer. Doesn't always mean we're talking inpatient psych hospital. It could be identifying the problems, getting intensive outpatient treatment, closer monitoring for safety in the home environment. There's good data the screening does lead to better outcomes. So those numbers, those rates of suicide we've seen go up, and which we've talked about before, over the last really 9-10 years. There are programs that are out there, like the screening program Children's is doing, which are demonstrated to decrease those rates. So this isn't just another little checkbox to do. We're trying to save lives.
And find out the kind of needs that, what kind of resources they need.
So screen, and that should lead to identification. Okay, do you need to see a therapist?
Yeah.
Do you need intensive outpatient therapy? Do you need to see a psychiatrist? Is it so severe that there's an imminent danger that we need to look at inpatient hospitalization? And so where in that stratification do we need to be?
Dr. Johnson, biggest piece of advice for parents right now?
Really, talk to your children. Ask them all the questions. If you have concerns about your child, let them know I'm concerned about you. I've seen a change in how you are thinking or feeling or behaving, and that's leading me to wonder and have questions. And so to really sit down with your children and ask them how they are doing, and ask them quite explicitly, are you having thoughts of not wanting to be alive? Are you having thoughts of wanting to kill yourself? I think we get scared to ask these questions because the answer can be scary. It would be hard to hear our child say that. But we have to know so we can then intervene and get them the appropriate care that they need to be safe and stay alive.
And advice for going back to school right now. A lot of kids are concerned, parents are concerned. I know you both have kids. You have young kids. You've got kind of teens and tweens. What kind of conversations are you both having with your kids?
So we had similar conversations even just last night. I really want to try to maybe change the focus on not what we don't have, but what we do have right now. So much of the focus, I think, can be all these traditional things that happen in life aren't happening or have been missed. And we need to acknowledge those. But rather than having me focus on, you have to wear a mask, is there going to be this sport or that sport, or are you going to be able to do this event or that event? I'm trying to really focus on trying to flip the script.
Right.
What are we able to do? You're able to walk to school. That's great. You're able to go to school. You're able to see your friends. You're able to do these outdoor sports. Focus on the positive.
And kids are so much better at doing that than adults, no doubt. No doubt. Like I said, easier said than done, okay?
I'm trying to do it.
Right, okay, but I love that. Flip the script, talk about what's good, not what's bad. What are your thoughts about that?
Very similarly, like affirming that kids get to do things, that we are fortunate that we have kids that are actually able to go to school. And so really being excited about getting, what new backpack do you want? What are the school supplies that you want? Really finding the things that kids are excited about for school and reinforcing that. And that although things may be different, there are lots of cool opportunities that will happen this school year, and really kind of focusing on the cool things that we still get to do with our kids.
Right.
Like go to school.
Flip it to almost a statement of grit towards the kids, too. Like you're going through a major event. You got this.
You got this.
And you can take pride that you are going through a hard thing.
Okay, so we're getting, my kid is getting very excited about his Baby Yoda backpack.
How cool is that?
Over mom
Baby
freaking
Yoda.
out about, are you going to be able to keep a mask on all day? So that's kind of what we talk about. Okay, so I'm going to keep asking you all some questions, but I know we have community questions coming in right now. Cliff, good morning. How are you? Nice to see your face.
Good morning. Good to see you as well.
Hey. Okay, so do you have some questions coming in?
Yes, we have a lot of questions coming in. The first one I'm going to ask here is from Isaac. As for the people at Marillac, how many have been nervous about getting the COVID vaccine? I know that some people have been afraid of getting shots in general, long before COVID.
What do you see at Marillac?
We do, and we're very proud that Marillac, we do offer vaccination to all the 12 kids 12 and above who are eligible for vaccinations, and if with their consent and family assent, we're excited to get them vaccinated. We are seeing, I don't know the exact numbers or percentages because I won't give the wrong information. There is some hesitancy still there. The similar things that Dr. Hawkinson just mentioned occur with 14-year-olds, 14, 15, 16-year-olds as well. Do I need it? Do I need it in my age? And is it safe? And we try to reassure them, yes, the American Academy of Pediatrics strongly recommends individuals who are eligible for a vaccine, for a COVID vaccine, to get the vaccine. One of the things I'll just share with Dr. Hawkins over there, we're not seeing a lot of kids have really significant problems after vaccine. We're not seeing any delay in hospitalization. Some kids have a sore arm. That's kind of what we're seeing.
Right? Anything to add to that for people who are concerned about their kids?
No, we've continued to show, extreme benefit compared to very minimal risk for any adverse events from these vaccines, both in the adult population and also in that 12 to 17 population as well.
So, Cliff, I was just going to ask Anil's question really quick, and he asked, are the rates increased because the kids are home all day? Is that why we're seeing an increase? And I'm thinking he's suicide rates. Is that true? Risk, what we saw when the kids are home all day, is there a risk in suicide rates?
So the big picture stuff for suicide rates is that from 2010 and 11 on, we have seen a pretty significant increase in suicide rates, 11 to 12 per 100,000 to up to around 17 per 100,000. So 12 to 17, that's a lot of kids who are dead. We see some variability over the seasons. With COVID, there's ongoing lots of research, which Dr. Johnson's alluding to try and figure out how much or what type of changes have occurred with rates of either death by suicide or suicide attempts during the COVID pandemic.
Anything to add to that?
Yeah, and the CDC does not stratify that information. It does not say which kids were in school, which kids weren't in school. Doesn't give location. It just breaks it down by basic gender, not even ethnicity, actually. And so we don't have a good feel of what those actual kids look like, but can kind of make some assumptions that when kids lose the routine, lose social support, if parents are having financial instability due to the pandemic, that stress does kind of trickle down to kids, that they're not immune from the stress that parents go through. So
I like that because it means we kind of have to watch all kids in all situations, not just one group of kids doing one thing at a time.
So if they're in summer school, they're okay.
Correct,
right.
yeah. Anil, I hope I asked your question correctly. Message us if we didn't. Cliff?
We have a question from Amy. In your opinion, which would be more likely to cause mental health issues in kids? Kids wearing masks in school, or 2-week quarantines and or virtual learning?
Good question.
The American Academy of Pediatrics is very clear that they feel being in school and having as much normalization is the best thing for them. That's their statement from July 2021. Kids need to be in school. I want kids to be in school. And if this is what it takes to get a kid in school, great. Let's do that.
Kids do good with masking. Did your kids do well?
Yeah.
Your kids masked?
I think most kids do better than a lot of adults with wearing their mask over
100%.
their nose and their mouth, that they get that. I mean, kids are at that age where they're quite malleable. They can be shaped quite easily. I will speak to the point where I think people have been concerned with kids and emotion regulation and understanding emotions because people's faces are masked. If you go back to 1968 was Mary Ainsworth attachment study, in which she looked at infants, so these are anywhere from 2-day-old to 6-month-old, 8-month-old babies, in which we really understand via the cognitive processes that kids attach well to adults when they are infants, and they learn facial cues as infants and toddlers. But by the age of 4, most children understand what we are saying by other means of our body language. That if your back is to your kid and you say something in a certain way, they understand the under message that you're giving them by the tone of your voice. So I know some parents are concerned with kids and facial and emotional regulation and understanding of emotions because people's faces are covered, but by the age of 4 or 5, kids do have other ways of recognizing body language and the tonal intonation that you provide that kids understand. And I will even give the example of if you've walked into a room with 3 children and they're all on a device, and you're talking to them, no one ever looks up to see your face to understand what you're giving back facially. They understand from other body language that you're giving what you're indicating with that. So
okay, you just explained my children in like one simple thing. But I think they're not listening to me. They really kind of are. Okay, good to
they
know.
don't take in your face all the time because, I mean, as adults, we look down at our phones and we're having conversations. And so for children, they really do understand communication via other means than looking at your face. So I want to let people know that for our infants, it's really important for them to see our faces because that's how they understand emotions. You can look at a baby and say something really rude to the baby, but you're smiling, and the baby's just cooing back at you because they don't know what you're saying, but they're reading your face, and they're looking at the facial features to understand that. But for our older kids, they don't need our facial expression as much to understand.
To understand that tone of voice. The mom tone, they know it.
The mom voice is real.
Good. All right. Cliff?
We've had several questions along the same line of asking how many deaths we've had in the hospital, especially recently with the new surge, and wondering how those rates are looking now.
Dr. Hawkinson?
Yeah, The rates on, I'm sorry.
So it was several. So we've had people asking just about our recent COVID deaths here at the hospital, just with this new surge. Do we have those numbers?
Yeah, we don't have those numbers. I think our last death was August 3rd. We do try to provide some of those details and demographics and vaccinated versus unvaccinated, age ranges, and some of the death. We don't have any updated rates on deaths or the characteristics of those patients yet. But again, our last death was on August 3rd. So we will try to get some of that information. We do try to present that as we're able to.
All right, maybe follow up Friday. Can we get that info?
Yeah, we'll see.
Maybe. Okay, so I have a question while we've got you. A lot of people, I know we talk about this a lot, but can you just go over the expected timeline for vaccine releases for those 11 and under?
Oh, gosh. I think some people were saying, maybe later in the fall, late September, October. We are not already now in early August. I haven't heard any other news. We know that the vaccine timelines have been expedited with the data analysis and then the recommendations. But we also understand that recently the FDA asked for more children to be in the trials, so that it could possibly identify any of those rare events that may occur. So I think if they're looking for more people to be involved, more children to be involved in those trials, it certainly may be September, October. I think everybody is waiting, but that is the best information we have at this time.
So Ashley says she has a friend who had COVID earlier this year and has lingering shortness of breath and brain fog. She has not been vaccinated. She's concerned the vaccine might make her long haul symptoms worse. What should I tell her? I thought that makes them better. Is that true?
Yeah, we have no evidence that getting the vaccine is going to actually worsen your long haul symptoms. In fact, there's those anecdotal reports, not a lot of peer-reviewed published studies, but there are those anecdotes that we see in the regular media talking about how some people do have improvements. We've even had a guest on who said that she felt better and wished she could actually get a third dose of the vaccine because getting dosed with the mRNA vaccines twice actually did make her feel better. So there's no scientific evidence to support the fact that you actually have worse symptoms, but actually from people's stories and anecdotes, you may actually have some improvement in some of those long haul syndromes.
Cliff?
Back to kids at school, Meg asked, she read in Arkansas school district that they were already having to quarantine for a week because the school didn't take precautions. Do you anticipate anything like that in our districts in the area unless there's mandated masks?
Yeah, just what are your concerns about, kind of here we go again, and concerns? I see it on your face.
Yeah, so I would flip. I am optimistic that if the school district that we want, everyone that wants their kids to be in school, but we want the kids to be in school safely, and after a year and a half of doing this, we know the basic stuff that needs to happen to have kids in school safely. We know about social distancing. We know about hand washing. We know about masks. So ideally, it is possible for us to do this, and there is actually pretty strong data this is done and done well, that we can have a safe school environment and get our kids back. I'm not in the field to know what's happening to whether or not those efforts are being made.
Dr. Johnson, just your thoughts on that?
I think we can look at some school districts last year that did it successfully, that had kids in school that did not have to quarantine whole classrooms or whole buildings. And so we know doing those things safely keeps our kids in school most consistently, which is, I think, as parents, we all want our kids in school.
I want my kid out the door.
No kidding. And I thought schools did an amazing job last year. I mean, follow the lead of the schools, when they're home, right?
And not only parents, kids want to go back to school. Yeah. Kids want to be in school.
Right.
That's where they need to be.
Yeah.
They need to be socializing.
I think if the people making those decisions do it in a thoughtful manner, and again, stick with the medicine and the science and the proven record of what happened once schools were able to get back, or even some of those private schools. And again, I think you do have to take into account every institution, every building, and those resources. Sure. But we still know, based on very good data, how to keep schools open, how to keep the children safe, those families safe, and of course the adults in those schools safe as well.
Yeah, good point. Cliff?
And along that line, Becca asks, she has kids that are 6 and 4, and one of her schools requires masks, but the other one does not. Is there any kind of type of mask that is better than the other to help protect her child, especially in the situation where it's optional?
Yeah, for those little kids, what do you think they should do?
The 3 apply, 1 to 5.
Yeah,
Something they would wear, I would imagine.
There have been studies. I think to your point, yeah, the first one is something they can wear easily. Anywhere from cloth masks to N95, you have surgical masks in there as well. But I think anything you can get them to wear comfortably and wear on a regular basis. And also, if they are in the room with other masked people, obviously the masks are going to serve as a good barrier to having expression of those droplets into the environment. That's the main goal of the mask. But yet still, even cloth masks do provide protection to the wearer and helping filter out some of those droplets as well.
You do as a sign of the times. I was school supply shopping. It's like grabbing my sanitizer, my Kleenex, my pencils, and my notebooks, and we grabbed the mask. I thought they were hanging right in front of me. I thought, oh, and it didn't even dawn on me to do that. I was like, oh, yep, grabbed a big old handful. But yeah.
And there's some fun masks these days, though. For the little ones, they got
right.
The whole line. Make it
They've got
fun.
mask fashion. They've got it going on. I love that. Okay, Cliff, what you got?
Neil, who had a question from earlier, he also asked, is there any talk yet of postponing any surgical procedures as capacity tightens?
Those questions are being asked and evaluated on a daily basis. Currently, there is no plan for any of those restrictions as we did initially in the pandemic, but we are always keeping abreast of the capacity issues that we may have. Right now, we have enough PPE, we have enough ventilators, we have enough critical drugs for when you come into the hospital. We do have enough ORs. So, again, that's an active question. I think it's a good question because we know that medical problems, normal, quote-unquote, normal medical problems, and surgeries do need to occur. Right now, there is no plan to have those restrictions, but that is a question that we continually ask and evaluate.
Okay.
Rebecca asked, where do we call to find info on what to do if monoclonal antibodies are needed?
That's a great.
Yeah, we do have, and actually our monoclonal antibody service and infusion service has ramped up recently in response to the surge. We have had more referrals. We have just had a meeting with the therapeutics group looking to tighten some of those restrictions, but we do have that number, and we'll try to get it for you here. We've had it in the past. It's just a general referral number that you can be referred. You will then get a screening questionnaire. People will ask questions. Just make sure you're meeting that criteria, but we can get that number for you.
Dr. Hawkinson, Rhonda has a good back-to-school question. She said she just got her son's 12-year booster shots, Tdap, and then she got these on July 15th. She wants to know how long she should wait to get the COVID vaccine. Can she go ahead and get that?
Yeah, definitely go get it. Yep.
Okay, easy answer. Cliff?
Yeah.
Sorry, I just lost the question here.
That's okay. I'm looking through too.
Randy was asking, why mask kids? Is this hampering their immune system? I think we've talked about this before. Why all the RSV now? Is that because weaker immune systems?
Do you know that, Dr. Hawkins?
Yeah, we tried to address this a little bit. The masks are not causing any reduction in your immune system. Again, we humans, our immune system has been trained and developed over generations and thousands of years. So wearing these masks for these times is not causing a reduction in your immune system. You are still getting presented with antigens on a daily basis, foreign objects that you can inhale, whether it's out in the environment, working outside and inhaling, or coming into contact with other things. Your immune system is still working on a daily basis. So wearing a mask does not reduce that. Why is RSV increasing now? It's hard to tell. We know that even in Australia, when they had the initial pandemic, their RSV season was delayed by 6 to 9 months. I think a lot of it now is the return to non-masking, the group gathering, people getting together more. So that is helping cause the spread of RSV right now. But there's no evidence to suggest that you have a reduction in your overall immune system from those non-pharmaceutical interventions that we have been doing, such as masking and distancing and hand washing.
Jackie wants to know, since vaccinated people can become infected, vaccinated people, not just unvaccinated, and pass along the virus, is there concern that the virus can continue to mutate? Basically, anyone can now pass it along.
Yeah, again, so going back to vaccinated people and spreading the virus, again, small studies, we still have a lot of questions to answer. The full scientific community is not fully behind that. We still want some more information on more data about how well can vaccinated people spread it. Again, the CDC changed their guidance based on that MMWR study. So we are still looking to answer that question. But anytime you have infection and you have replication going on in your body, at that point in time, because just of the nature of the virus, it can mutate, it can change. That is just an inherent process in the viral replication. Certainly if you are immune suppressed and you don't have a good immune system, you can have much more and longer viral replication, and that could affect and add into development of some of these new variants or variants of concerns. If you are vaccinated, that will hopefully decrease the spread overall, and then overall decrease the amount of illness you have, decrease the amount of viral replication. And that's why it's so important for everybody who is eligible to get vaccinated so that we can help reduce the spread. And then thereby helping reduce the spread, we can help reduce any new variants that arise because you just don't have as much viral replication going on in general.
Cliff?
I think Melody has a good question here. Do the kids still need to wear one mask per day, then wash before wearing again? Or much like clothes, is it okay to wear 2 days in a row?
You know, we always want good hygiene. I think certainly if you can continue to do the regular changing out and having one and cleaning one, I think that's good. If they go wearing it for, maybe 2 to 3 days, it's probably not going to be harmful or anything like that. But certainly continue to keep the mask clean. If you can keep one for use, one for cleaning, and one in storage to use it the next day, I think that's a good practice. But also, if you're not able to wash it or clean it, maybe getting 2 or 3 days out of it is not really going to be too harmful.
Tiffany wants to ask our doctors about masking peer pressure, especially kids that are in high school. And she has her son hangs out with kids that aren't vaccinated. Just how to talk to them about kind of the whole masking is cool thing and making them feel comfortable to kind of be leaders, if you will, in school.
Yeah, and I would kick that to also when we talk to our kids about not using drugs or not making poor choices when they're driving their car. This fits into that same realm of how do we talk to our kids about not succumbing to peer pressure and about their confidence and ability to do what they believe is right, to kind of live to their kind of core beliefs. And so talking to your kids and talking to them about how it is a struggle if they have peers or friends who are not supportive or who may say things, and really coaching your kids on how do you want to handle that, how do you want to interact with the kid who may not be supportive or who may be negative about it, and giving them some tools to really have a response to that. That's
I think
and also doing it kind of appropriate for where they are developmentally.
Yeah.
So the education for the pick an age, 12 and under, maybe 10 and under, you're going to be wearing a mask. Blah, 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 blah. You're going to be wearing a mask because those are the rules of the school, and so that's what you're going to be doing. I think providing a little bit more detailed conversation, appropriate if we're talking about a high schooler, making sure that they have a right to know some of the details, like the school's doing masks, these are the rules, and here are the reasons why, and so how you're helping help yourself and help protect your community as well. So I think giving you that information, sort of what you would be doing again with the substance abuse conversation. If you're going to have a substance abuse conversation with an 11-year-old, it's a very different conversation than with your 17 or 15 or 17-year-old high school kid.
Can I just say all the cool kids are doing it? All the cool kids are masking?
You do that. All the cool kids.
All that you said, but that's probably what I would say. Okay, Cliff.
Peggy asked, is the Delta Plus variant a big concern?
I had this question a little bit yesterday. I think what we have to understand is that with the technology that we have and the science that we have, the ability to sequence many isolates and identify these isolates or these variants on the molecular level down to one base pair of the genome, I think we are going to continue to find variants. Delta Plus, again, right now there doesn't seem to be another variant in our community or in the United States that is outcompeting or more fit than Delta variant. Delta variant is the big viral variant that is making that surge right now. Is it of concern? I think as we continue to have spread, and this goes back to the vaccine question that we just had, as we continue to have spread, we are going to see more and more variants. And I think it just depends on how much do we, as a community and society and individuals, want to get vaccinated, because we know that vaccine will help reduce the overall infections and replication. Is Delta Plus a variant of concern, or should we be concerned? I don't think right now that that's a big issue. Again, nothing has been shown to outcompete Delta. Delta has moved in. If you remember, right before Delta, there was Alpha variant that was spreading and surging in Missouri and Kansas and other areas. The Delta variant easily outcompeted that for the most predominant isolate that we have in our community now. So I think we are going to see these and continue to see these, and that is true since the beginning of the pandemic, when we saw it change from that original Wuhan strain, if you will, to different variants throughout the time of the pandemic. This is just one more. We are going to keep identifying and finding these. But what really we need to understand is, does it cause a difference in clinical disease? Does it make it more severe? We thought that with Alpha, but that was ruled out with a good paper from the Lancet looking at that. So I think we have to understand, what are the differences in these variants? Do they cause more disease? Are they really more fit? Are they able to spread easier? Again, remember, we have really no mask restrictions now, or we haven't for some time. I think that really contributed a lot to the spread and the surge of the current variant as well. So to answer the question, Delta Plus, I think it's too early to tell. We don't really know. I think we really have to deal with what we're dealing with today, and that is Delta variant, and that is lack of vaccination. And we need to continue to promote vaccination and get those people who are unvaccinated, get them vaccinated, to help reduce the chance of other more concerning variants arising.
Joanne has a question. I think it's a short answer. Will this ever go away?
For the foreseeable future, it doesn't look like it will ever go away. To what level can we go back to pre-pandemic living? I think that depends on every community and every individual. We still have so many people, again, it goes back to lack of vaccination. We've said before, this is really becoming two pandemics: the pandemic of the vaccinated, which are mostly protected from that severe disease and death and hospitalization, and the unvaccinated, which now are contributing to the vast majority of people that go to the hospital and seek medical care, the vast majority of the people that go to the ICU and die. And so we need to continue to promote vaccination so that we can help and decrease the rates of those unvaccinated people, and overall decreasing the rates of coronavirus spread, and thereby getting back to more normal type of life that we did understand and probably still can remember since before the pandemic.
Cliff, last question or two?
Yes, I have a last question here from Michelle. Our school is mask optional. How do I have the conversation with my elementary kids why they need to wear a mask? We have already had our kids made fun of due to our family continuing to mask.
Michelle, I'm sorry to hear that. That makes me sad that your kiddos have been made fun of for trying to be safe. And so I think framing it to your kids why you're having to do the mask, modeling to them when you're at the store wearing a mask, making it clear that you guys are doing what you know to be the best thing to keep your kids healthy and safe, and to acknowledge that some kids just aren't very nice and they're going to say things that one aren't true, but two aren't nice. And to let your kids know that even though those things are happening, they're doing the right thing. I would say it's also important when your kids are in school to also make sure teachers know that these things are happening, so teachers can be on the lookout, and your kids know the safe adults to go to and say this is happening, so they can kind of say it hurt my feelings or what they feel from this happening. But I am sorry that that's happening to your kiddos. That makes me sad.
It was a lot easier when it was required for everyone to wear the mask.
Yeah.
Now it's going to be a choice, and that makes it tough, right?
Yeah.
That's a tough one.
And especially with an elementary school kid, that's...
No.
The school
Why
needs to
make
be
them choose?
The school needs to be stepping up and making sure, hey...
We're a week out.
Yeah.
Let's hang tight and see how this all
Let's see
unfolds. It'll be really interesting.
It'll be good.
Do you think they're going to turn to masking? Do you think that it may get to that point where everybody's back to how we were? It's required for at least elementary?
I hope so right now, just for the fact that we need kids to be in school. Parents need kids to be in school so they don't have to look for childcare. They can do their work. They can keep putting food on the table and having that job. We can keep the kids safe. We can keep the household safe. Again, we know scientifically and medically what works and what helps keep people safe. Unfortunately, there are other factors. Unfortunately, political factors do play a role. But we need to continue to promote the science and the medicine and do those things that we have shown to work from this last year of school.
Yeah.
And we've really seen how, especially in the pediatric population, this has really been a psychiatric crisis. It's been really a mental health crisis. Talk to a lot of physicians at Children's Mercy, and they'll say the same thing. And so whatever we can do to get back to normal, to keep our kids safe, to maybe turn the tide of kids harming themselves or dying by suicide, that's what we're trying to promote.
All right.
And I would think also, maybe, masking, yes, but if you're outside on recess or outside in gym, if you're out in the outdoor, I don't think you need the mask. I think people can, it's pretty spread out on those playgrounds and those areas too, so I think that's safe. So it's not like they're going to be wearing it for an extended period of time the whole day of school.
Yeah, good point. All right, great questions today. So we're going to try to get to those on Follow-Up Friday if we didn't get to yours today. I do want to get to our final thoughts from our guests. Again, thanks so much for being here. I'm going to have you start us off, Dr. Johnson.
Yeah, I just want everyone to know that we've got, for many school districts, a week or two in counting, and kids are back in school. So to have conversations with your kids now about the preparation for school, what school will look like to your knowledge at this point, knowing that things will change, so kids have understanding that how we start school may not be how we are in 2 weeks or a month or how we end school, but to really ask your kids questions of how they're doing, checking in to make sure their mental health is okay. I really feel like this is going to be a time, and this has been a time of resilience, that this is building resilience in our children because this is adversity. Dr. Douglas, you used grit earlier, that this does promote a level of grit and resilience to our kiddos, and so if we can foster that and encourage that, but also let them know when things are rough, it's okay to acknowledge that it's rough, and let's talk about that.
Dr. Douglas, final thought.
Slightly different. So, again, my big passion in life is I'm trying to see if I can decrease the rate of kids who are dying by suicide. There is a easy primary prevention that lots of families can do. There are lots of responsible gun owners in the Kansas City, Kansas, Missouri side, which is great. Please make sure that your firearms are locked up and not available to your children. That's something I'm sure everyone knows. Great to do a double check. You can say, well, my kid knows not to mess with guns. Evidence is really strong, making sure that that firearm is locked, ammunition is separate, and the kids don't have direct access. So that if the child does have the first week of school and has a mental health event and they're severely depressed or thinking of suicide, they don't have eminent access to means of dying.
Wow, thank you.
So it's harsh, but that's real.
Reality.
That's
Thank
real.
you. So glad you brought that up. And just before I let you go, though, a couple of quick things. When you say ask your kids direct questions, I always like it when you tell us what do we need to be asking them, active questions, so that we get real answers.
Sure. So really direct questions, always promote what Dr. Johnson was just talking about, good listening skills, how are things going, being present, but really specific questions, are you thinking about hurting yourself? Are you thinking about dying? Do you ever feel like you want to fall asleep and never wake up? These are signs that the kid is not just having a daily blues, feeling a little sad. These are children who are thinking that they would prefer to be dead. And unfortunately, this is one of the leading causes of death in the adolescent population. So those thoughts, just as you would take it seriously that your child needs to wear a seatbelt when they're in a car, when you're hearing stuff like that, that needs to get evaluated.
And talking to your kids about suicide does not mean that will prompt them.
You're not prompting, you're not encouraging it, you are increasing the chance that they may survive.
It's okay to say the word.
You can use the word suicide.
You're not going to give them an idea.
No.
Thank you for reiterating that. Dr. Hawkins, and final thoughts.
I'd like to thank our guests. Nothing is more precious to us than our children, and their insights and expertise today have helped talking about children's emotional well-being, physical well-being. We know things that can keep children safe in the schools. We want to keep children in the schools for many, many reasons. So these are the ways to do it. We have seen that. I do have the number for the monoclonal antibodies, and the referral is 913-588-1600. If you can call that, you can start to set up to get screened for monoclonal antibodies. Those are for internal and external referrals as well. So there has been talk about Delta Plus or other variants or Lambda variant, just understand we are going to continue to see variants. This is how viruses replicate. This is what happens. This is what they do. It is not surprising, but the way to get through this is to continue to vaccinate. We can keep you individually safe, keep your bubble safe and your community safe. So please continue to encourage vaccination. This will help us continue to do the things we want. Go out to the K, go out to Arrowhead, start having fun again, or keep having fun as we have been, and hopefully decrease this surge and just get back to more normalcy through this pandemic.
Great. Thanks to all our docs today. We really appreciate you. And thank you for being with us today. Tomorrow, it is Follow-Up Friday, so Dr. Stites and Dr. Hawkinson will be here to answer all your COVID questions ahead of the weekend. So make it a great day, and we will see you back here at 8 a.m. tomorrow.